Welcome, and in this video I want to think about flu immunisations or immunisations for influenza. Now at the moment governments around the world seem to be going flat out to get as many doses of influenza vaccine as they can. And this does seem to make a lot of sense because we've got the influenza season coming up this next winter in the UK and in the US. Starting about November, getting worse December, January, there's going to be a lot of cases of influenza. We know this, it's the same every year. So it would make sense to vaccinate as many people against influenza as we can. This means we're not going to get as many people with confusing symptoms because the early symptoms of COVID-19 and the early symptoms of influenza are very, very similar. As well as that, influenza has complications and people can end up in hospital. And because COVID-19 is still going to be around this fall, this autumn, this winter, then hospital places could well be in great demand. So it makes sense that if we can minimise influenza as much as we can, get the influenza cases down as much as we can, we'll have more reserve healthcare capacity to look after patients who might be suffering from the complications of COVID-19 disease. So for a period of time we're going to have both. So on the face of it, this makes perfect sense. But, and I'm giving you the bottom line of this video now, there is some research, albeit fairly tentative, that indicates that people that have had influenza vaccine are more prone to getting other respiratory viral infections. So it's not impossible that having the influenza vaccine makes it more likely someone's going to get COVID-19 disease. Now, I think this is unlikely, but the evidence I'm going to present is based on a placebo-controlled randomised trial, so it has to be taken seriously. So I strongly suspect it's going to be perfectly safe and indeed a really, really good idea to get vaccinated against influenza this autumn, this fall. But I really feel that because of this possible conflicting data, that this is something that really needs to be officially addressed by health officials who should give a definitive answer to this question, if it's the right thing to do or not. So anyway, let's look at the background first of all, and that's the bottom line. If this video is not for you, that's the bottom line. I think there's a question needs to be answered, and it's a very significant one, I feel. But looking at what's happening, so demand for flu vaccine soars as countries plan for a second COVID-19 wave. So this makes sense. This is in the English paper, The Guardian. So officials in the UK are considering whether to offer flu shots to everyone. Now, the leader of the opposition in my country has called for flu shots for everyone over the age of 50. But that's only good if that's efficacious. And as we'll look, there is counter-argument to that. I suspect this is a good idea. But there is a question that needs to be answered first. The possible benefit of adjunctive the possible beneficial adjunctive effect of influenza vaccine to minimise severity of COVID-19 disease. So this study here is actually suggesting that if you have influenza vaccine, that's actually going to reduce your chances of getting COVID-19 or getting severe symptomatic COVID-19. Now, of course, the influenza vaccine is not going to vaccinate you against COVID-19. That is a coronavirus. It's a different virus. But here, the resultant immunity from the influenza vaccine against prior influenza infection would at least in part foster immunity against SARS coronavirus 2. Now, this is a phenomenon called cross immunity. So there is such a thing as cross immunity. So what this paper is saying, and do look these up for yourself, the links are always there. What this paper is saying is that if you are vaccinated against influenza, yes, that's designed to give you immunity against influenza, but as a benefit, you're going to get some increased immunity, not total by any means, but some increased immunity against COVID-19 is what this paper is suggesting. And that, as I say, that's a well-known phenomenon. It's called cross immunity, so it's not ludicrous. So that's what that is suggesting. Public Health England. It is more important than ever that we have effective plans in place for the 2021 flu season to protect those at risk, prevent ill health and minimise further impact on the National Health Service and social care. So again, Public Health England are saying we absolutely need to go flat out on flu vac. It's more important than ever that people get influenza vaccine. And that was a really good idea according to Public Health England. And at the moment they are trying to buy the stocks to facilitate this process. So they'll have, basically they're trying to buy as many doses of influenza vaccine as possible. Now this paper here is from the Journal of the American Medical Association, JAMA. So the dual epidemic of COVID-19 and influenza, published on the 11th of June. Again, look it up for yourself. They're saying there's a likelihood of co-epidemics of COVID-19 and influenza. Well, it's more than a likelihood. This autumn, this fall and this winter, it's guaranteed. We're going to have influenza, and COVID-19 is not going away before the next influenza season. COVID-19 will be with us in the 20 to 21 winter, no question about that. And they are saying that the Journal of the American Medical Association is saying this could cause considerable morbidity and mortality. People will get sick, morbidity, people will die. And this is particularly the case if some people who have influenza get COVID-19 at the same time. That's going to be a bad combination and greatly reduce the prognosis. And JAMA correctly say this will stress the healthcare system, of course. Now, to support their argument, the Journal of the American Medical Association give data from the 2018-2019 flu season. And what they're saying is that, now to be fair, this is the United States data, but actually only about, I think it was just less than 50% of the people in the United States who needed the vaccine were vaccinated. So the uptake wasn't that brilliant. So in the 1918-1919 flu season, for which there's now full data in the United States, there was 35 million cases of influenza. There was just under 500,000 hospitalisations, and there was 34,000 deaths related to influenza. So that is kind of, actually that is, if anything, it was a mildish flu season. Actually, no, 18-19 was probably about an average flu season. The last one was mild. The 1921 was mildish. So that's the. So this is the severe morbidity, hospitalisations. This is the mortality in the United States as a result of influenza in the 18-19 flu season. But JAMA is saying that vaccination prevented, and this is even with only about 50% uptake. 4.4 million cases of influenza were prevented. 58,000 hospitalisations were prevented, and 3,500 deaths were prevented. So good efficacy there from the vaccination programme. That is a significant improvement on how the situation could have been otherwise. Seasonal influenza vaccines have variable year-to-year effectiveness. Now, what they do is, the World Health Organization every year, they look at the three main strains of influenza that are there and make up a vaccine for those three main strains. And to be fair, it is a bit of a guess. It's a highly informed guess, but nevertheless, it's not always that accurate, and the degree of cover is not always that good. Some years it's very good, other years it's not so good. But they go on to say this can significantly reduce morbidity and mortality, especially with high coverage. So it's an effective strategy. It's known to be an effective strategy. And they do advocate mass flu vaccination. That is the recommended strategy, that people get vaccinated against influenza. And they give that evidence as benefits. So all sounds a really good idea then. Let's get everyone covered against flu because we don't want the double whammy. But paper from Clinical Journal of Infective Diseases 2012. Basically what this study is saying is that children who were vaccinated against influenza were more likely to get other respiratory viruses. This is the concern. So the paper was called Increased Risk of Non-Influenza Respiratory Viral Infections Associated with Receipt of Inactivated Influenza Vaccine. In other words, the standard flu vac. The viral particles in the vaccine are inactivated, so they don't cause influenza themselves. Reputable journal, 2012. Look it up for yourself. Now, this article says that influenza vaccine is effective in preventing influenza viral infection and associated morbidity among school-age children. So this study was done in school-age children. No equivalent study that I am aware of or could find in the literature has been done on adults. The work simply does not seem to have been done, and I have looked. Now, this is a randomised, placebo-controlled trial of influenza vaccine. So we had a group that were given the influenza vaccine. They were given the vac. And we had a group that weren't given the vac, that were given the placebo. Usually this is a nasal vaccination for school-aged children. So we had this group given the vaccine, this group given the placebo, and allocation to the group, to one or the other group, was randomised. So this is a proper clinical trial. It's randomised and it's placebo-controlled. So as far as the individual child was concerned, they were treated in exactly the same way, only that group was given the live vaccine. That group was presumably given a little bit of salty water. It was a placebo. So this is a proper trial. Now, 115 participants were followed up for 272 days. So 272 days, good level of follow-up. 115 participants, to be quite honest, not that high a number. Not too high a number. But a high enough number to get statistically valid data from, and the results were statistically valid. So what this means is, when you have if you have a big effect, then it's easy to detect, relatively easier to detect a big effect with a smaller number of samples. Whereas if you have a subtle effect, if the effect is not that great, then you need a much larger sample size in order to detect that effect. So the fact that there was only 115 participants actually indicates that this could be a reasonable sized effect. And as I say, the results were statistically significant. It's very unlikely that the results arose by chance. The flu vaccine group had a higher risk of acute respiratory infections, what we called ARIs. So the flu vac group had a higher risk of acute respiratory infections associated with confirmed non-influenza respiratory viral infections. So what this is saying is that the group that had, this group here that had the flu vac, this group that had the vaccine here, they ended up, okay, they're going to get less influenza because this virus works, although it didn't work particularly well in this study, but normally it works. So this group are going to get less influenza, as you would expect, but this group got more other viral infections, viral respiratory infections. They got more viral respiratory infections. The placebo group got less viral respiratory infections, and the difference between the two groups was statistically significant. So this looks like a real effect. So the flu vaccine group had a higher risk of acute respiratory infections. So the question in my mind is, if we vaccinate everyone against influenza this autumn, is this going to make it more likely that we get other respiratory viral infections? And of course, COVID-19 is another respiratory viral infection. And the relative risk in this study was 4.4. In other words, the people in this group, the vaccination group, were 4.4 times likely to get other respiratory viral infections than were the placebo group. So that is a significant finding, and a statistically significant finding as well. The majority of non-influenza respiratory viral detections were, and these are the types of the viruses. So the people in the experimental group that got the vaccine compared to the people that did not get the vaccine, they had more rhinovirus, which is the common cold virus. They had more Coxsackie virus. Now, Coxsackie virus, if it gets into the bloodstream and the heart, can be actually quite a dangerous virus. Echovirus, and interestingly, they also had more coronavirus. And this is the coronavirus called 229E. And this is one of the coronavirus that causes common cold type features. So we've said before, the 7 coronaviruses infect humans. There's the SARS, the MERS, the COVID-19, and there's 4 others that cause typical cold, coryzal type symptoms. And that was one of them. But the fact that there's a coronavirus there, that infection with coronavirus was more prevalent in the people that received the flu vaccine, does raise questions about the current coronavirus pandemic. Receipt of Fluvac could increase influenza immunity at the expense of reducing immunity to non-influenza respiratory viruses by some unknown biological mechanism. So that is that is these people here writing in the Clinical Journal of Infective Diseases. So they don't know what the mechanism is, but they suggest that it could be there because it does seem to be an empirical finding. And they say temporary, non-specific immunity leading to interference between epidemics of respiratory viruses could have important implications. So you've got to say this is almost a prophetic type statement, isn't it? That vaccinating against influenza could have implications for other viral infections. It's only one study, but it raises a question that should be answered, because I must say I am dissatisfied with the advice that I've had from the World Health Organization. And even in the UK, the chief scientific officer, the chief medical officer have said things that have transpired to be later transpired to be unhelpful at best. So this is something that we really need some sort of definitive statement on, I feel. And what concerns me really is that all this planning for mass vaccination, they don't even seem to have considered it. It just doesn't seem to be an issue. But I'm raising it as an issue now based on this research. Now, this is a couple of other letters from the British Medical Journal. So this letter here is under this heading, the UK's public health response to COVID-19. And this is saying there's a possible correlation between influenza vaccine and COVID-19 death rates in European countries. So there is a prima facie case to suggest that the countries that had most influenza vaccine had the highest rates of mortality from COVID-19. Now, that is not a definitive statement, it's a suggestion, but it's a suggestion in the British Medical Journal, so that really should be looked into, especially because here, this data already exists. So the data for who was given influenza vaccine when exists. That data exists. The data of who died from that also exists. The question is there a correlation between the two, and is that a positive correlation? So if that axis is increased numbers of vaccination in countries, that is increased deaths from coronavirus. Is there a positive correlation between those? As one value increases, does the other value increase? or not, or not. And if there is that positive correlation, if vaccination increases and death rates increase, or if countries that vaccinated less, do they have less deaths? Well, will that be there? Or a country that's vaccinated more, do they have more deaths? Would that be there? Then that's a simple correlation that could be done. The data to do this exists. And it will be a relatively simple matter for epidemiologists to get hold of this data and to produce that correlation. Now, of course, even if they find a perfect correlation, that does not indicate causality, because correlation never proves causality, but it would mean that it was definitely worth looking further into. And that data exists. No reason why this graph shouldn't be drawn. And I would advocate strongly that it is drawn. Flu shots increase the risk of coronavirus infection, another letter. Possibility that seasonal flu shots are potential contributors to COVID-19, again from the British Medical Journal. Again, not data, this is just people thinking out loud, but it's a question that should be answered. Flu shots increase fivefold the risk of acute respiratory infections caused by a group of non-influenza viruses, including coronavirus. And here they say the odds ratio is 4.91. In other words, the people who've had coronavirus, according to this letter, the patients who've been vaccinated against influenza are 5 times more likely, according to this study, to get non-influenza viruses, including coronavirus. Influenza vaccine may alter our immune system, non-specifically to increase susceptibility to other infections. Don't quite know how this would work. Don't need to know if it's found out that it works, if it does work in the real world. So there we are. We've got some interesting studies there. I think the question is a genuine question. It's one that should be asked. It's one I'm asking. And I really feel there should be an official response before we launch on an absolutely massive flu influenza vaccination campaign. We should know how safe this is, because of course the first rule in healthcare is that first, do no harm.